Hello my people, this is Mwanguzi Shadrack, your doctor from Health Uganda. As part of our Reproductive Health Awareness Month, today I'm going to be talking about cancer of the cervix. Worldwide, this cancer of the cervix is the fourth most frequent cancer in women, with an estimated 604,000 new cases that were reported in the year 2020. And of the estimated 342,000 deaths from cervical cancer in 2020, about 90% of these occurred in low and middle income countries, of course our Uganda inclusive. Women living with HIV are 6 times more likely to develop cancer of the cervix compared to women without HIV. So that means when you're HIV positive, because this HIV weakens your immune system, and this gives room for the virus, HPV, human papilloma virus, to go ahead and cause cancer. Of course, in these low and middle income countries, there is limited access to the preventive measures, and cervical cancer is often not identified until it has advanced and the symptoms are worse, and that's when we get to know that someone has cervical cancer. In addition, access to treatment of cancerous lesions, because before someone gets the full-blown cancer, there are skin changes around the cervix that can be seen, and if these are treated promptly by the appropriate treatment modalities that are available, we could prevent many people from getting cancer of the cervix. But now these are limited in our settings, resulting in higher rates of death from cervical cancer in such countries. There are developments, of course, and strategies and efforts to ensure that we fight this off, but partly because people are not informed about what it actually means to have cancer of the cervix, how it can be prevented, when they actually don't know it can be avoided, or even when you get it, or as long as it has been detected at an early stage, it can be treated with complete recovery. We are not going to win this battle, and that's why as Health Uganda we have come out to spread awareness to ensure people actually get to know things to do with cancer of the cervix, and also add a brick on what has been done so far through the different mobilizations and organizations. The high mortality rate from cervical cancer globally could even be reduced further if appropriate and effective interventions were done at the different stages of life. Yes, that's for a fact. To go deeper into this virus vis-a-vis cancer of the cervix, I want to say a large majority of cancer of the cervix is due to the human papilloma virus. These are about 95%, even more, of the cases. HPV, or human papilloma virus, is the most common viral infection in the reproductive tract like vagina, then the vaginal canal, around the cervix, uterus, and tubes. And most sexually active women and men will be infected at some point in their lives, and some may be repeatedly infected. And the good news is more than 90% of the infected populations eventually clear the infection. Otherwise, if everyone that would get HPV infection would advance into getting cancer of the cervix, it would even be worse, because it's the most common. But the good news is majority of the cases, people just clear it off. So cancer of the cervix is by far the most common HPV-related disease, and nearly all cases of cervical cancer can be attributed to HPV infection. Although most HPV infections clear up on their own and most precancerous lesions resolve spontaneously, there is a risk for all women that HPV infection may become chronic. Chronic means you may have it for a long period of time, and these precancerous lesions progress to invasive cancer of the cervix. It takes about 15 to 20 years for cervical cancer to develop in women with normal immune systems, and about 5 to 10 years in women with weakened immune systems, such as those with untreated HIV infection. And that's why these days, for all women that live with HIV, there is an effort to ensure that they are regularly checked for cancer of the cervix or those precancerous lesions, to ensure that it is detected quite early, because they are at a slightly higher risk as compared to the general population or to the people that don't have HIV. There are strategies to ensure that CA cervix or cancer of the cervix is fought off, and we divide these into primary prevention, secondary prevention, and tertiary prevention. With primary prevention, we look at girls between the ages of 9 and 14, and these are assumed not to be exposed to this HPV infection because it is assumed that they have not yet engaged in sexual activity. So at this stage, we do a lot of vaccination because we have a vaccine that's quite effective against preventing HPV infection. So at around that age, 9 to 14, we vaccinate these girls. It is also underway that we provide adequate information, just like we are teaching now. We provide adequate information about such things. It's health education tailored towards prevention of sexually transmitted infections, and we encourage the use of condoms, safe male circumcision, prevention. Advising the young people not to smoke, because tobacco also increases the chances. So that's under primary prevention. With secondary prevention, it means people have been exposed to the virus, the human papilloma virus, and now we just want to prevent this human papilloma virus from causing cancer of the cervix. And this is effected from 30 years of age in women from the general population, and then 25 years of age for women living with HIV. Remember, we said those that live with HIV are actually a greater risk as compared to the others. So for those with HIV, we start from 25. Those without, we start from about 30 years. And what do? We screen them for HPV infection. We keep checking them. For those that don't have HIV, we check from between 5 to 10 years. Every after 5 to 10 years, you are expected to check at least once for HPV. For those that live with HIV, because they are at a greater risk, we check for between 3 to 5 years, at least once, so that in case of anything that develops, we are able to see it, detect it when it's quite early. The moment we find something suspicious, positive for the infection, or a suspicious lesion, we initiate you on treatment as soon as possible to ensure that it doesn't progress into the invasive cancer of the cervix. We also have what we call the tertiary prevention. It means you have been confirmed to have cancer of the cervix. Now, what do? Because you've got it. And this can be in all women, whether you are HIV positive, whether you are negative, whatever the age, as long as it has been found out, we just initiate you on treatment for the invasive cancer at any stage, really. And the treatment modalities may involve a bit of surgery, radiation, radiotherapy, chemotherapy, and palliative care for some who may have the terminal illness. So generally, those are the kind of strategies we use to prevent cancer of the cervix. So some people might be worried, oh, cancer of the cervix, so how may I know if I have it? Just in case I had not gone for screening, what are some of the things that I could look at and be like, oh, this could actually be cancer of the cervix. Number one, if it is in the early stages, you might experience irregular blood spotting or light bleeding between periods. That is in women of their reproductive age. Number two, the postmenopausal ladies or people who are no longer having their periods, that is about 48, 49 years and above, you might also experience a bit of spotting or even heavy bleeding. Number three, you might experience bleeding after sexual intercourse. And if you also notice an increased abnormal vaginal discharge, and sometimes it might be foul smelling, those might be symptoms for early cervical cancer. As the disease advances, more severe symptoms may appear, and these might include persistent back, leg, or pelvic pain, weight loss, fatigue, loss of appetite. You will also get that foul smelling discharge from the vagina, causing a lot of discomfort, and some people may also have swelling of the leg or both the lower extremities. And if the cancer spreads, because it has the ability to spread from the cervix to the different parts of the body, so you might get other symptoms based on the part of the body where the cancer has spread to. But the most important thing is everyone in those age groups should go for screening. If you have a child, a daughter, between the age of 9 and 14, take them for vaccination, because the vaccine has been proved to be effective. And for the ladies that live with HIV, 25 years and above, make it a point to go for screening every after 3 to 5 years. For those that don't have HIV, at the age of 30 and above, make it a point to go for screening for at least once in 5 to 10 years, so that the moment they detect anything suspicious, they start you on treatment. You will actually have complete remission, because at that stage the illness can be dealt with. The beauty about this is it really takes some bit of time before a person who has a suspicious lesion, some changes on the skin, gets the full-blown invasive cancer of the cervix. For people that don't have HIV, it takes about 10 to 15 years, and those that live with HIV, it takes about 5 to 10 years to transform or to transition from pre-cancerous lesion to full-blown invasive cancer of the cervix. So between that time, really, something can be done to ensure that